Thank you, Gil, and good afternoon. Prior to 1998, little useful information was available about the status of cancer on Guam. And in fact, during the 70s and 80s and early 90s, there was a rising crescendo of complaints about the lack of any good information about cancer. We did start about 1995 trying to aggregate data from death certificates, but that really it didn't serve the purpose of a cancer registry because it didn't include incidence data. And in the words of a famous educator, that was a pretty lame cancer registry. In 1998, we were successful in getting then Senator Eduardo Cruz to introduce legislation that would make reporting of cancer mandatory by the medical people on the island. But because at that time they were also having an economic problem on the island, there was no funding with the legislation, and collection was largely passive. In other words, we waited for the data to come into the registry. With the advent of the U-56 grant, we were able to hire 2 data collection specialists, and they went out and really beat the bushes to collect cancer data, and the data collection became active rather than passive. And in 2005, a memorandum of agreement was signed between the University of Guam and the Department of Public Health and Social Services to jointly run the cancer registry, and GCR became a unit of the Cancer Research Center of Guam. Specific aims of the cancer registry include collecting incidence and mortality data. This is collected from Guam's civilian hospital, the Cancer Center of Guam, and approximately 20 local private healthcare providers. Collecting information on cancer patients treated off-island is a problem in some cases, but it's being provided by the Guam Medical Referral Office in the Office of the Governor, the Hawaii Tumor Registry, St. Luke's Hospital in Manila, and state vital statistics offices. In reviewing patient records, the cancer data collection specialists go out and review charts, and this provides more reliable diagnostic and treatment data, which will support future studies on the effectiveness of treatment modalities, survival rates, and risk factors. Our most recent publication is Guam Cancer Facts and Figures, which is a pretty comprehensive compilation of cancer statistics, and that and other publications of the Cancer Registry are available on the University of Guam website. The Cancer Registry participates actively with the Guam Comprehensive Cancer Control Coalition, and they have been very supportive of Cancer Registry activities and sponsored publication of the Guam Cancer Facts and Figures booklet. We continue to provide Guam cancer data in support of various agencies, institutions, and NGOs, including Department of Public Health and Social Services, American Cancer Society Guam. We've worked with the University of California at Irving, and we also assist the University of Guam faculty and students in their research activities. Looking at the ethnic disparities in cancer incidence, which is really the origin of the interest in developing the cancer registry, Chamorros have high incidence rates of cancer of the mouth and pharynx, 18 per 100,000 compared to 10.3 in the U.S. Nasopharynx, liver, and cervical cancer. Filipinos in the period 2003 to 2007 did not have the highest incidence rate for any cancer site and had the lowest incidence rates for stomach, liver, and cervix. of all the ethnic groups on Guam. And I think maybe as interesting as the high incidence rates may be for research, maybe we should do some research into why some groups have low cancer rates. Micronesians had the highest incidence rates of all the ethnic groups on Guam for cancers of the mouth and pharynx, lung and bronchus, liver, cervix, and thyroid. Asians had high incidence rates for stomach, pancreas, colon, rectum, anus, and breast cancer. Caucasians had high incidence rates for cancers of the mouth and pharynx. The highest rates for cancer of the esophagus, prostate, urinary bladder, non-Hodgkin lymphoma, and leukemia. Activities and accomplishments in the last few years include obtaining full member status in the North American Association of Central Cancer Registries. We are now the Cancer Research Center of Guam is the data collection hub for the Pacific Regional Central Cancer Registry, which is intended to collect data from all the U.S. Pacific Island associated territories and countries. We have 3 peer-reviewed recent publications. Again, this and other publications are available on the University of Guam website. And we're very happy to have received or secured 1% of local tobacco tax revenues to sustain GCR activities. Future plans include continuing to support research on cancer in the U.S. API populations by providing as accurate and complete data for all cancer patients treated on Guam, to support University of Guam faculty and student research, to contribute efforts to disseminate local cancer statistics to support health promotion and health education activities. A particular example is the nasopharyngeal cancer pamphlet, and to support the Pacific Regional Central Cancer Registry. Thank you very much for your attention.